This is Shushmita, Assistant Professor, Biomedical Department, Rohini College of Engineering and Technology. Okay, in this video, I am going to present a topic on gait analysis and sports medicine. Okay, first thing is gait analysis. Gait analysis is a study and measurement of human walking pattern. Okay, it will include the movement of the limbs and the overall body posture during the gait cycle. Usually this gait analysis is a study of human walking pattern. Okay, then it is mainly used to assess and analyze gait abnormalities, evaluate the effectiveness of rehabilitation treatment, and for identifying and diagnosing various musculoskeletal, neurological and gait analysis. Okay, this method is used to assess and evaluate human walking pattern. Okay, we can also say it as a gait. Okay, gait means human walking pattern. Okay, this one involves a continuous observation, then measurement and interpretation of various parameters related to the way an individual walk. Okay, which means it will continuously observe when to walk properly, then how to walk likewise. Okay, gait analysis will provide valuable insights into the mechanics of walking. This one will help and diagnose and monitor certain medical conditions and guide treatment decisions. There are two main types of gait analysis, subjective and objective. Okay, first thing is subjective gait analysis. This one involves visual observation by a trained professional. The visual observation is done by a trained professional who will examine and identifies any abnormalities or deviation from normal walking patterns. Okay, then objective gait analysis means it will uses a particular technology. Okay, then this will use a wearable sensors, force plates, cameras, then specialized gait analysis systems for monitoring a patient's walking pattern. Okay, these tools will capture data on various aspects of gait. It will mainly calculate step length, cadence, ground reaction forces, joint angles, muscle activity and timing and all. Okay, these are the main types of gait analysis. Then clinical rehabilitation. This gait analysis helps and identify abnormal walking pattern for the patients with a condition such as stroke, Parkinson disease, then any orthopedic problem likewise. Okay, then sport performance in the sense athletes and coaches will use a gait analysis to improve the running or walking technique, then for preventing injuries, then for biomechanics research in the sense it is used to study the human locomotion process. Okay, then prosthetic and orthotics. This is gait analysis plays a major role in designing and fitting a prosthetic limbs and orthotic devices. Okay, by studying the gait of an individual, the clinicians will design the prosthetic and orthotic devices for that particular patient. Okay, then gait cycle. Gait cycle in the sense it will it means a sequence of events that occurs during one complete stride. Okay, that is from the moment one foot makes contact with the ground and to the next time the same foot makes contact again. Okay, that is gait cycle in the sense it will measure one walking cycle. Okay, which means it starts from one moment that one foot makes contact with the ground to the next time the same foot makes contact again. Okay, it is divided into two main phases, stance phase and the swing phase. The first thing is stance phase. This phase begins when a foot touches the ground and lasts until the foot leaves the ground. Okay, stance phase means what? This phase begins whenever foot touches the ground, and it will end when the foot leaves the ground. Okay, it is further divided into subphases. Okay, first thing is initial contact. Initial contact in the sense the moment the foot is making initial contact with the ground. Okay, then loading response is the period when the body weight is transferred onto stance leg and the foot absorbs the impact. Okay, that is loading response. Then mid stance in the sense the point where the body's weight is directly over the stance leg. Okay, and the foot is flat on the ground. Okay, that condition is mid stance. Then terminal stance, the body continues to move forward and heel starts to lift off the ground. Okay, then pre-swing in the sense final phase of the stance, where the toe pushes off. Okay, where the toe is removed from the ground. Okay, then next phase is swing phase. Swing phase begins when the foot leaves the ground and continues until it makes contact with the ground again. Okay, it will consist of following subphases. First thing is initial swing, that is the foot lifts off the ground and the leg swings forward. Okay, then mid swing is there, the leg continues to swing forward and the knees typically reaches its maximum flexion. Okay, then terminal swing is there. Here the leg starts to decelerate as it approaches the ground, preparing for the next stance phase. Okay, then this gait analysis is a continuous monitoring of walking cycle. Okay, that is gait analysis. Okay, then there are 8 phases are there. Totally 8 phases. Okay, initial contact, loading response, mid stance, terminal stance, pre-swing, initial swing, mid-swing, late swing. Okay, this is a pictorial representation of a gait cycle. Okay, the first thing is initial contact where the heel strike the ground. Then during loading responses, then foot flat, mid stance is there, then terminal stance, then pre-swing. During the pre-swing, the toe off. Okay, initial swing, then mid swing, then terminal swing is there. Okay, this is a overall pictorial representation of a gait cycle. Okay, then next concept is sports medicine. Okay, sports medicine is a branch of medicine that focuses on the prevention, diagnosis, treatment and rehabilitation of injuries and conditions related to the sports and exercise. Okay, this it encompasses a wide range of healthcare professionals including physicians, orthopedic surgeons, physical therapists, athletic trainers, sports psychologists. They will work together to provide better care to the athletes and individuals participating in physical activities. Okay, then goals of sports medicine. Okay, first goal is injury prevention. Okay, sport medicine professional will educate athletes on a proper training techniques to prevent the risk of injuries. Then diagnosis and treatment. Okay, if there is any injury, they will provide a particular treatment to that athletes or others. Then rehabilitation. Physical therapists play a major role in rehabilitation process. Okay, this is for designing and implementing exercise programs for the athletes to regain their older strength, flexibility and functions, okay, after an injury. Then performance and enhancement. Sports medicine professionals work closely with the athletes to improve their performance by various training programs, then providing nutritional guidance, then addressing biomechanical issues. Okay, that's all. Then concussion management. Okay, then sport medicine specialists who trained in evaluation and management of concussions, which are common in contact sports. Okay, they will provide guidance and appropriate return to play protocols and ensure athletes safety through the recovery process. Okay, then sports psychology. Okay, there is psychological aspects of sports performance, including stress management, goal setting, then mental skill training. Okay, these are essential for the athletes. Then sports medicine is an interdisciplinary field that combines knowledge from medicine, then exercise science, biomechanics, psychology. Okay, its primary focus is to support athletes and active individuals in achieving their fitness goals, and is also helping in avoiding injuries, and it is promoting long term health and wellness. Thank you all.